All right, everybody, welcome to another edition of Elevating with Marcia. I'm your host, Marcia Hawkins, and welcome to the program today. Again, another very dynamic guest on my program. I know many of you that listen to the show know that I've had Dr. Brett Agan from telewellnessmd.com on the program many, many times, and Michael Villagomez is going to join us today, who also has an affiliation with Telewellness MD as well. So I'm super excited about the show today. But first, a little bit about Stephen. In the dynamic world of clinical exercise physiology, very few can boast a journey as profound and varied as Stephen's. An academic foundation secured by graduate degrees in physiology from the esteemed University of Texas at Austin, his professional trajectory has been nothing short of inspiring. The very essence of Stephen's approach to healthcare and human performance lies at the nexus of scientific rigor and compassionate care, something you all know if you listen to my show know that I feel the same way. Endocrinology was Stephen's initial calling. Over a decade, Stephen delved deep into the intricate dance of hormones and their impact on the human body, something we talk a lot about on this program. This expertise set the stage for Stephen's subsequent role at 10-year tenure as an assistant professor in health and sciences at Long Island University. Here, Stephen not only imparted knowledge, but also absorbed insights from the next generation of health professionals. The classroom, with its ebb and flow of ideas, reinforced Stephen's belief in the continued learning and adaptation. Professional sports leagues took note of Stephen's growing repute. Now, of course, we talk about sports on this program all the time. Positions in the NBA, NFL, and NHL became significant milestones in an already illustrious career. These platforms provided him with an environment to refine methodologies focusing on unique demands of elite athletes in the world of sports medicine. In recent years, he's ventured into the avant-garde field of peptides, seamlessly merging past experience with his burgeoning area of study. This transition exemplified Stephen's knack for staying at the forefront of health and performance innovation. However, physiology isn't Stephen's only forte. A renowned expert in supplementation and nutrition, his holistic approach to health is both comprehensive and precise. Beyond all professional achievements and passion lies his core philosophy. He wants to help and he wants to heal. Whether it's assisting an athlete reach their pinnacle or guiding someone through the maze of nutrition, the end goal remains consistent and the same: to better the human experience. So with that said, I would like to introduce you to Stephen and say hello. Hi, Stephen.
Hi, thank you so much for having me.
What an impressive resume you have. And more importantly, what an impressive ideology that you have and your commitment and your compassion to people feeling better. That doesn't get any better than that.
It honestly, it doesn't. And it sounds strange for me to say this, but my work sometimes doesn't feel like work at all. It doesn't. It's a purpose. It's a gift. And I'm very, very lucky. And I always, I have something that always resonates with me. And so I have the attitude of gratitude.
Oh, I know. And anybody that listens to my program, they know exactly that is really, I always say I'm in the minute to win it. I want to feel good. I want to, live my life. I want to leave nothing on the table when I get that tap on the shoulder and it's time for me to depart this earth. I want to leave it all on the field. That's just kind of how I feel, and I can identify with a lot of what you say. So I want to back up a little bit and talk a little bit about the fact that I've had Dr. Brett Agan of Telewellness MD, which is what your affiliation is, and how we became friends, if you will, and just the dynamic conversations that Brett and I have had on the air over the years and what we've talked about, and just how significant, and his frustration with traditional medicine and people walking into the doctor's office and getting a happy pill, a pain pill, or a why me pill without ever really getting at the root cause of their illness, or more importantly, what I would say is their symptoms, and not being able to, really heal them in the appropriate manner. And just, layering medicine, prescription drug upon prescription drug upon prescription drug without really coming into actually healing that person. And what's important about that, while we are going to talk about the peptide therapies, is so much more than that. So I want to start with that. let's talk a little bit about some of the peptide therapies that are offered. And I loved how you really delved into and explaining not only what they are, but what they do.
100%. Going back is people are completely disenfranchised with medicine because the medicine that we now know, the system is broken.
Mm-hmm.
If you can't see the writing on the wall, it's one of those you could lead a horse to water, but you cannot make it drink. And all we do is we fight symptoms. We never treat the root cause. And even more unfortunate is how medicine currently practiced is reactive. It's reactive. We could put out the forest fire in the trash can, but we choose not to. We wait until it engulfs everything.
Well,
if
I could just interrupt you for just 1 second. I want to identify why that is. Why are we going to the doctors and just getting prescription drugs rather than looking at what the symptoms are and fixing and getting to the root cause of those symptoms?
That's a great question. That is a great question. Sometimes I sit with that question. It's dependent. What really has its hand in it is the insurance companies first and foremost, and how you have to play by their game or you don't get paid. And then two is it's the pharmaceutical companies that are pushing this stuff, right? Pill here, pill there.
Mm-hmm.
You don't want to think today, take this pill. You're thinking too much, take that pill. You don't feel right, you hate Tuesdays, take this pill.
Mm-hmm.
They'll sell us anything, and that's kind of where we are. It's a top-down broken system, and I don't know the best way forward from it. But one thing I do know is that there are agents, there are solutions that can help us, and that's kind of where peptides really kind of come into this role. It was just funny because me and Dr. Agan we spoke together at a conference just a few days ago. Come to see us so you don't get sick is the kind of overarching theme of this. Is if you don't get sick, you won't have to go to the doctor type of mentality. But the key thing is you have to go to the right doctor so you don't get sick, right?
Well, can I just interject a little bit, though? I completely agree with everything you're saying, but I think also, let's just cut to the chase on it. It comes down to money. It comes down to money with the insurance. Yep, money with the insurance company and the absolute gluttonous amount of money that the pharmaceutical companies are making. So I was talking to Dr. Agan on one of the programs, and I was explaining to him how when my children were younger and they would get like an ear infection or, bronchitis or whatever, and I would go to the pharmacist, I would, go to the back of the pharmacy and there would be a pharmacist there and she would fill the prescription, number one, and she would cash you out. So there was one pharmacist, and then I noticed over the years there were two, but there was never any more than that. So I thought that was kind of interesting. Now, when you walk into a CVS, if you will, you have a drive up, you have 4 lanes of cashiers, you have 4 to 5 pharmacists on, and then you have 7 or 8 techs on, and some of the larger ones. Did we get that sick? And then I'm going to play devil's advocate on myself. I know a lot of people could say, well, look at the amount of research and development that they've done in the drug industry over the years and are able to heal us. You know what? I'm not buying it. We have not become that sick, but what we have become is we have become that ill on side effects from a lot of these drugs. Would you agree with that?
I have to fully hearted agree with that. Here's an interesting wrinkle. The top 4 drugs that are prescribed in the United States, 4 of them are autoimmune disease drugs, right? They're helping us stop from eating ourselves alive, because autoimmune disease, that's what it does. It literally destroys ourselves from the inside out. Now, the top 4 drugs for the top 4 pharma companies yield them $4 billion a year. So $16 billion a year for pharma to help us not destroy ourselves. Now, why is that? How did we get to that point? And it's hand in glove. It's because we're being fed poison. That's just the way we look at fast food. Go to 7-Eleven, go to any store, and it's sugar everywhere. You go to a gas station, it's not gas. You can buy anything that's sugar laden, right? They're feeding us poison, and then we can take a pill so we can keep doing it.
Well, that's interesting too, because when you, and this is going to kind of segue into our next segment. I totally agree with you. Yeah, I totally agree with you. However, and I'm going to play devil's advocate on some of the peptide therapies and some of the, let's just throw it out. The Ozempic craze right now, where everyone in Hollywood is taking copious amounts of Ozempic and, all the therapy. And I'm a big subscriber of the peptide therapies. Don't get me wrong. However, I do worry about some people that, are getting on that for all the wrong reasons. And I again, it goes back to the root cause of why are you overweight? And to me, it's just like with the lap band and the, gastric bypass and all the things that you can do to lose weight. Ultimately, it has, I believe, a 5% success rate. And a lot of that is because they do not get at the root cause of why they are overeating. So I do want to delve into that a little bit before we go to the next segment and really dive into the peptides. Like, are we not able to re-engineer this whole process to get people to really look, basically take self-responsibility?
Well, that's a very, very good question. And again, unfortunately, it goes down to money. You have a family of 4. Right? You need to go get nutritious food. Go to Whole Foods. That's going to cost you $50 for the day. Right? The only way that you can do that cheaply is buy fast food, less nutritious food, and that's the reality of it. If we look at the obesity rates in the United States, and there is 4 states in the United States that are less than 30% morbidly obese, not overweight. There's 4 states that are under 30%. Most of it is around 50 to 60%. 50 to 60% of the state is not overweight. They are morbidly obese.
Unbelievable.
Now that should scare all of us. Yes. Now the GLP-1s have been getting demonized. They've been getting demonized for Hollywood this, Hollywood that. However, what people fail to realize, GLP-1s have been around for 30 years. Right? They've been here. It's what's going on is what are they really fixing, right? And that's what we're going to dive into. On the other note, me and Dr. Hagen were talking about this. They're giving GLP-1s, glucagon-like peptides. That's the family of these drugs. They're being studied for addiction, Alzheimer's, cancer, cardiovascular disease. People that are on a GLP-1 have a lower incidence of cardiovascular disease than the general public. This is even if you have diabetes. If you have diabetes and you take this medication, you have a lower cardiovascular incidence than the general public. That's a very interesting statement.
Very interesting.
We have to look at these. Now, you're absolutely right. You're absolutely right about it doesn't fix the root cause, but now they are being researched correctly on how it changes our brain. Most importantly, our second brain, because there's neurons located in our stomach, always has the term second brain. It's very, very interesting on how these things are changing our minds.
Well, let's stop there. We're going to take a quick break because I really want to delve into the peptides when we come back and really bring the audience from A to Z on how the peptides work, the benefits. And I agree with you. It's not just about it. Yes, personal responsibility about our lifestyle choices is definitely part of it. There is a matrix, though, and in this matrix, these peptides do have a pecking order and a benefit for people when used appropriately. So I want to talk about that. We do need to take a quick break. You're listening to Elevating with Marcia. Quick break. We're going to come back with Stephen Villagomez, and we're going to delve into the world of peptide therapy. Quick break. We'll be right back. Everybody, welcome back to Elevating with Marcia. You're listening to Marcia Hawkins and Stephen Villagomez. I won't go through your whole bio again, Stephen, but I want to take this segment to talk about the evolution of the peptide therapy, metformin, its place in this whole scenario matrix, if you will, and specifically how it can benefit people. So I'm going to let you run with it on this segment.
Absolutely, thank you. So metformin is a very, very interesting drug. It's been studied. It's the most widely studied drug that we know. It helps lower our sugar, which therefore lowers our insulin. Right, the insulin is the biggest thing here. By lowering our blood sugar and therefore lowering our insulin, our body can utilize fat as an energy source, also known as lipolysis or beta oxidation. And it is the evolution because Dr. Andrew Mortarella here in Cornell Weill, he has the most amazing analogy of metformin is like a rotary phone, okay? And now GLP-1s are like a smartphone. So you can see where the evolution has come to this. And we're going to dive into that. I wanted to let everybody know this. Everywhere else in the world except the United States, metformin is an over-the-counter pill.
Interesting.
We could get for pennies on the dollar, but through insurance, it's about $400 a month.
Wow. Metformin is $400 a month in prescription,
give or take.
Wow.
You could go to Italy or England or Germany and get. You go to Canada. I get mine from Canada, and I want to say it's like maybe $9 for 3 months.
Can I ask you a quick question? So what place does the metformin have in the peptide therapy chain? Is that like the jump-off point for people? And I'm playing devil's advocate, and I'm inquiring because I know people listening are going to have the same questions. So is that like, and that's pill form? So someone could take a pill form of metformin to induce weight loss, correct?
That's correct. And some people that are needle phobic, metformin is always a very good point. I don't want to lose everybody in getting too scientific with it, but metformin also has its role on a multitude of other things, from the anti-aging, cardiovascular risk, neuroprotective effects. It has its hand in a lot of things, but the overall is just the reduction on how our blood sugar works, Because blood sugar by itself, if it gets too high, it's like a bunch of teenagers in a house party, right? It's chaos. And then insulin gets released. Again, remember, just touching base, when insulin is present in the bloodstream, right? This is a big scientific factor. When insulin is present in the bloodstream, we inhibit lipolysis, right? We inhibit it. We turn off fat burning. It's like you can't drive your car and put gas in it at the same time. I'm up for a challenge. Even that seems a little daunting. So we have to figure out, okay, insulin don't burn fat. The only time insulin is present is if we consume carbohydrates, sugar most notably. The more sugar we consume, the more insulin is released, and therefore we do not burn body fat. For the most part, I have not seen a lot of very skinny diabetics. There are out there. There's a few of them, but for the majority of them, they're overweight, they're obese, they're morbidly obese. So that's why it is a very entry level into this peptide world. Metformin is a great sugar-lowering agent. It's very, very safe. It's very, very effective. You will lose some weight. You're not going to get the same GLP-1 effects. But you know what it is, Marcia? It's a step in the right direction.
Well, let me ask you a quick question about that. So it sounds like someone who's overweight has self-induced, and maybe this isn't the right terminology, but almost a self-induced form of diabetes where a skinny person who develops, say, type 2 diabetes, it's more of a clinical reason why they got it. Is that accurate or no?
Yeah, there could be genetic dispositions. Same thing with type one diabetes, because type one is an autoimmune, a different type of diabetes, but nevertheless in the same family.
Yep.
Uh,
Okay, if someone was looking to lose, and maybe it's just their age and maybe their lifestyle, they're not as active as they once were. Maybe they were an athlete when they were younger, and maybe their knees are shot, so they're not running anymore. Maybe they put on a few like 5 to 10 vanity pounds. Would they be a good candidate for the metformin? Given that they really don't need the whole artillery of like a semaglutide or the GLP-1.
yeah, it would be. It would be if you combine the right lifestyle. Absolutely, you'll get there. It also has a lot of other again benefits. I'm looking at a very, very interesting article, which we should probably mention. September 29th, 2021, Harvard, Dr. Schmerling at Harvard Public Health, titled "Is Metformin a Wonder Drug?" Right?
Mm.
And it does, because it has all kinds of other helpful effects besides the weight loss, besides the lowering of the blood sugar. It's anti-inflammatory. It helps with PCOS. It has its hand in everything. So yes, it is a good starting point for people that are looking to get into this.
Awesome.
Is it gonna be the same results? You know what? It's hard to tell, because I think we have to look at everything as like an N of one, right? Every person is different. What works for one person. One person might. When I got on metformin in my late 30s, I did it because my hemoglobin A1C was at 5.6. Now that's not bad.
Hmm.
Is it great? No. That's why I decided to get it. Be aggressive. I like to be aggressive with prevention.
Hmm.
And I did, because I'm very, very active and I eat well, and I did manage to lose like 3, 4 pounds of body fat from it.
Hmm.
So that it's a good agent. It's a good agent. It's a good thing to have. It's a good tool to have to put into your repertoire.
Hmm. So can I ask you a quick question though? So if somebody was say, 75 to 100 pounds, maybe even 50 pounds overweight, why are some of the people that are on it not losing weight when they have type 2 diabetes? Because I know several people that are on it and they're not losing weight. So what's the difference on that?
People that are that overweight have very, very bad lifestyle choices.
Hmm.
Um, that's usually the root cause.
Let's not
Um,
sugarcoat it, no pun intended, right?
it's not. And then usually what the case is too, you're gonna throw in a social economic status factor as well.
Okay.
It plays hand in glove.
Okay. That's fair enough. Okay. So yeah, because I know that there unfortunately is a lot of, new websites that have populated. And just by the mere fact that we're having this conversation, my social media timelines are going to be flooded with semaglutide and GLP-1 and metformin and all of that. And there is right now on the internet street corner, if you will, there are a number of sites that will send you these protocols and medicinal properties and get you on it without a lot of background. And I know with telewellnessmd.com, which I will put the link in to this airing, this podcast, if people want to click through and make an appointment with Dr. Brent and learn more and see what would be appropriate for them. But there's so many out there, but I feel as though I hope that people will gravitate towards a site that these people are not just looking to make a quick buck. Because when I've had Dr. Brent on the program and now you on the program, there's and for me, I love having both of you on the program because there's a real first intention on what you're trying to accomplish, which is to get people healthy. Where I'm unfortunately afraid a lot of these websites are just looking to make a fast buck. And I can really hear the passion in your voice and what you have for this program and what it can do for people.
Well, thank you. That means a lot to me. So thank you. There are this is another interesting yet truthful aspect of it, and this might be good for your listeners, and more than happy to provide information. There's websites there, and not
Cut out for just a second.
$25 for 90 days, and then it goes up to I think $35. No, maybe excuse me, it's $15 for 90 days for 1 gram, which is exactly what you want to be taking. And then it goes to $25 for 90 days. So for a year, it's going to cost you about $100 for an entire year of metformin. There's sites out there that are actually trying to help out. It's kind of what happened with the whole Mark Cuban with getting drugs cheaper, because most drugs, let's say, might cost, let's say with all of it, it comes down to, let's say, 45 cents to make, right, per pill. And pharma will they'll charge you everything for it. So there are sites, there are things out there that are, that are moving forward. Telewellness MD is a fantastic way to get right information and the right biologics to help you. And there's others that they're helping people get medications for what they truly cost, nothing, right? Not to mention, remember, metformin is only a drug here in Canada and Mexico, in the EU. It's a supplement.
Isn't that amazing?
Right? See how broken that system is, knowing that, like, when I started realizing this, probably with some of your listeners too, you want to scream, and and pretty much don't just turn on whatever media source or the TV or something else, and they'll just be like, look here, don't look there, don't look there, just we'll keep you entertained right here.
Right. It's amazing.
That's where we're at. That's where we're at.
It's amazing. All right, let's take a quick break. We're going to come back and let's delve into the GLP-1. I want you to talk extensively about that. We've already talked on the phone several times about that, and or actually that lengthy conference call we had 2 weeks ago. And I want to really delve into that, because that's really, I think, where the rubber hits the road with the peptide therapy. So quick break. You're listening to Elevating with Marcia with Stephen Villagomez. We're talking about peptide therapy, and we'll be right back. All right, everybody, welcome back. You're listening to Elevating with Marcia. I'm your host, Marcia Hawkins, and today we're talking with Stephen Villagomez regarding peptide therapy. You've all seen it. It's probably flooding your Facebook page, your Instagram page. There's actually, Stephen, at some point, I'd love to do a program with you about low-dose naltrexone. That's another huge fan of that as well.
That is
Dr. Brent and I have talked about that, and I actually have 2 doctors in my area. They're actually both my physicians, and we've had extensive, talks about communication about low-dose naltrexone. But that's going to be for another program, because I want to stick to the peptide therapy today. And in this segment, we're going to be talking about the benefits of GLP-1. So I'm going to let you take it away and explain what it is and how it can help.
Okay, so GLP-1s, glucagon-like peptides, been around for a while. Started off with Byetta, which was tied to the meal. Then Victoza went to the day. That's getting revamped. And now the GLP-1s, which are the Ozempics, the Trizepatides, all of the other, throw letters against the wall medications they come up with. What a job that is to name things. Right? It's just such a wild, wow. Skyrizi, right? It's just one of those things. Back to these GLP-1s. There's a lot of different ways that it works. So let me just go off the top. What are the benefits? One of the benefits, right? I'm going to go top 10 benefits, right? Improve glycemic control. Remember, it gets the glucose insulin, right? The glucose insulin system back into play. Lower the blood sugar, lower the
Hold on, Stephen, I lost you. Can you back up for just a second? It kind of cut out, please.
Sure. Which one should I go right from the improved glycemic control?
Yeah, that'd be great.
Okay, so I'm going to give you the top 10 benefits, but you know what? Let's just go the top 5 benefits, right? Because they're all going to be hand in glove here, and I'm going to show you how that works.
Okay.
You improve glycemic control. You're getting the glucose insulin paradigm working correctly, right? Lower the blood sugar, lower the insulin. Remember what we mentioned earlier, when insulin is present in the bloodstream, you inhibit lipolysis. So let's remove insulin and we increase lipolysis. Dun, 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 right? Burning body fat.
Yep.
So the number 2 benefit of GLP-1s, weight loss, right?
Yep.
Weight loss. Number 3, with the weight loss, we have a reduction in cardiovascular risk. One of the best ways to have a stroke is by having blood pressure issues. What's the best way to have high blood pressure? Be overweight, right? You see how that goes together. All right, just the last one that we're going to really dive into here, Marcia, and this is where I want all the listeners to really get this one. It slows gastric emptying. It slows what's in your stomach. Now, we've heard nasty side effects, and we're going to touch base on those later because this is the one. It slows what you eat, right? And think about that.
Can I just ask you a quick question? What causes our stomachs to empty quicker?
Diabetes.
Oh, okay. Good to know.
One of the biggest things in the diabetic population is it causes rapid gastric emptying. When you have rapid gastric emptying and it goes through your stomach into your small and then into your large intestines, guess what's not happening? Absorption, right? Things are flying through your gut. We don't absorb. Now, malabsorption is leading to a lot of issues right now. Think about it, right? If we don't absorb things, that's why we have micronutrient deficiencies. We have deficiencies across the board, and that right there is, pulling on the Jenga block at the very bottom, right out of the gate. Yeah. Right? Like, oh, this is a good idea. So that's the thing with that gastric emptying. By slowing it, we keep everything in the stomach. Now, if we were to slow gastric emptying, and then we have, let's say, a lifestyle modification of, why don't we put the perfect meal in that stomach and then slow it from emptying? That right there will change a lot. It will change your blood work, and it'll change the way your body thinks of food, right? That's the thing that these GLP-1s are being really, really looked at. It changes your relationship with food, right? It's also looking at, sorry about that, is our relationship with food is a very, very, very interesting dynamic, right? We have this kind of FOMO, fear of missing out, going out to dinners. In the overall, if we look at the numbers, again, remember, looking at the diabetic populations, right? The rates are through the roof. And it's not because they're looking at food and getting overweight. They are overeating. So GLP-1s, slow gastric emptying, you simply can't keep filling your mouth. That, very powerful. That's why these GLP-1s are also being looked at for, it's really an interesting one, is addictions, including alcoholism, right? Let's just say we have Billy Bob, and he wants a Big Mac, right? And he's going to drink a case of beer that night, right? Because that's easy. When you think about it, I've seen people drink way too much, myself included at times. But hey, we're all humans, right? We all have to deal with what we deal with. So this is the thing. If you give Billy Bob a Big Mac and he eats that Big Mac and he has a case of beer, I would sit there and I would go all in. I'd go all in with every penny I own to be like, all right, Billy Bob, let's start drinking. Halfway through that case, he's going to be so full and nauseous. He's not going to want it. Imagine that. That's what they're looking at for addiction. Slow the gastric emptying, and you know how we've all overate to the point of we're uncomfortable, right? Yep. There you go. Do that with drinking.
Yeah. Oh, that's interesting. I never thought of it that way, but you're right. I mean, if all of a sudden your body's saying, uncle, bad enough, you're going to stop. Even a full-blown raging alcoholic, I believe, given the with what you're saying, they just like someone who has had gastric bypass and they eat a little bit of food, they're like, okay, I can't eat anymore. The unfortunate piece of that is a lot of them eat through it eventually,
Yeah,
because yeah,
that's not, yeah,
yep,
absolutely.
yep,
I
interesting.
I'm sorry, go ahead.
No, that's just interesting. We're talking about food, but you're right. I mean, if they've got a and you are right. I actually interviewed several alcoholics for just a study that I was doing for one of my shows, and I was just asking them to run through on a normal day what they were drinking. And ironically, a lot of them who overdrank, not all of them, but I would say maybe 60% that I interviewed, 60% of them also overate. The other 40% did not. And the 40% that did not said that they drank for so many years that they damaged their taste buds and food did not taste good to them. So they would actually consume more alcohol in lieu of the food. But this one person I interviewed said, I said, just run me through an average day of how much you drink, because that's what I was trying to, identify. And she was telling me that it would be normal for her to pick up a large pizza and go home and put on the TV, eat the entire large pizza and a 12 pack of beer. I mean, that blew me away. I don't think I could do that in a month.
I've been on tirzepatide. It's a dual acting GLP-1.
Mhm.
I use it for the anti-aging effects,
Mhm.
and again, I have my ear to the ground, and I have a few academic affiliations with friends and whatnot.
Mhm.
It's just what they're looking at with these. It's remarkable. It's really kind of a cutting edge thing, and it's just that. And I was just saying, I'm on a low dose of this, and I'll tell you one thing: if you gave me a pizza and a 12 pack of beer the day after an injection, I would cry if I had to eat that because
Interesting.
it's so thick.
So, in addition to helping people lose weight, it would also help them because, again, we are in a society that feels at the end of the day, even if you're not a quote unquote alcoholic, we are by bad habit. A lot of people go home. I don't do this, but I know a lot of people that do. At the end of the day, they've got to pour that one or two, three glasses of wine at the end of the day just to decompress from a stressful day. So, if I'm hearing you correctly, it will also address that as well?
That is what we're talking about.
Wow, amazing.
It's retraining the brain. I'll just say the people I have it from a clinical standpoint, almost
Mhm.
like a case study.
Mhm.
And actually, with Dr. Agin, we had a woman at the conference who was in tears, not tears of sadness, but tears of joy, right?
Mm.
How it changed her relationship with food because look, there's a lot of people that eat out of comfort, right?
Mhm.
That's what they do, right? And then you throw drinking in, we always overconsume, right? Look, people are not going to Sweet Green or making a protein shake after a night of drinking. They're going to go eat more garbage,
Mhm.
right? Right?
Mhm.
That's just the reality of it. I wanted to tell the listeners too, and I think this is a very good kind of a quick transition, or at least a sidestep. Everybody keeps the side effects, gastrophoresis, right? It turned to cement in their stomach, right? Because GLP-1 slower, it slows the gastric emptying. Looking at some of the dietary recalls, I can't mention kind of the university right now. It's kind of a white paper,
Mhm.
which you're getting they're giving out a little of the details, but they can't say this, right? They do a dietary recall of what these people had that had the most severe gastrophoresis. That's where your stomach locks,
Mhm.
right? I could give you two. The two of my favorite is one. He was 358 pounds and he had two number ones, and they didn't say what fast food restaurant, but I mean, does it matter? Does it matter if it's McDonald's or Burger King or
No.
Wendy's, right? Does it matter what two number ones he got? Imagine eating that garbage. Yeah, and your stomach, and then you slow your stomach. Doesn't that? I want everybody to hear this out. Imagine forcing your stomach to slow and then fill it with trash, fill it with the worst food, and then you get sick. What is that for you?
Mm-hmm.
Is it your
Exactly.
stomach or is what you put in it? It's the problem.
Yeah, that's interesting because you're right. And garbage in, garbage out, really. And in that case, garbage not going anywhere. It's going to sit there and make you feel terrible. Interesting, interesting. So I want to, before we go to the break, I just want to recap. So the GLP-1 is actually the clinical name of the Ozempic, the semaglutide, the Wegovy.
Tirzepatide,
Yes.
the GLP-1 is the medication family, right? It's the last name. They're all part of that. There's a lot of different ones because a lot of different pharma companies want to put their hat in the ring.
Got it. All right. Let's take a quick break. When we come back for our final segment, let's talk about how we can get people started. Maybe go over just some, tie up some loose ends with what we talked about today, and then how people can get started. Again, I'm going to have my affiliate link in the posting of this podcast. And of course, you can always direct message me and I can get you in touch with everybody to, have a consultation with Dr. Brent, and we can take it from there. Quick break. We're going to be right back. You're listening to Elevating with Marcia. I'll be right back. Welcome back. You're listening to Elevating with Marcia. Today we have Stephen Villa. What was your last name again?
Villagomez.
Thank you. I have a client right now with a last name of Lopez, and I was confusing the two, so I do apologize. And we're talking about peptide therapy. This is our last segment. We're going to wrap it up with talking just overall. We're going to kind of wrap up the previous three segments, talk to you a little bit about how you can get going with these peptide therapies. And and then we're going to talk about some of the future shows that we have planned for you. So welcome back to the program, Stephen. And when we went to break, we were talking a little bit about GLP-1 being the pharmacology name for the semaglutides and peptide therapies overall. Quickly, I don't want to spend too much time on this, but what is the difference between a semaglutide and an Ozempic and Wegovy and I can't think of the other names. What is the difference between? Is it just different pharmaceuticals that are putting it out, or if you could just put that?
There is one new one because semaglutide is actually the generic name for Ozempic.
Oh, okay.
So when people think semaglutide, Ozempic, same thing. GLP-1s are the class of families, right? That they're glucagon-like peptides. Here's a fun fact for the listeners. Glucagon-like peptide is found from the spit of a Gila monster, those little lizards, right? That's where we got this from. We got it from the spit of a lizard. Yeah.
Oh my God! You saved back to the last segment to tell me that.
I know, right? Oops. Sorry about that. Now,
that's amazing.
Okay, so that is one. The only other one that has a dual mechanism of action, which I'm a big proponent of, and even me and Dr. Agan are switching people slowly from semaglutide to tirzepatide. Mm-hmm. Tirzepatide is Mounjaro, and this has two mechanisms of action. It is a GLP-1, but it's also a GIP, which is a glucose-dependent insulotropic polypeptide. I know that says a lot. It's just for the listeners, it has two mechanisms of action instead of just one. Wow. But other than that, GLP-1s, they've been around for a while. The efficaciousness is there. It's just they've kind of got into the mainstream because of some people that got into it, mostly Hollywood. I don't think I know that it kind of got demonized a little bit, which these things tend to happen. And what we do have to know, what all listeners have to know, when people are like, oh, the diabetes couldn't, I have diabetes, I couldn't get it, I couldn't get it, I couldn't get it. No, you could always get it if you want it. You just didn't want to pay for it. So let's make sure that we keep everybody on track on what truth is, right? So it's always been, it's easy to get. You just have to, if you really, really want it, you have to pay for it.
So, can I ask you a quick question? What would be the criteria in terms of how much overweightness, for the lack of a better word, how many pounds do they need to be overweight to be a candidate to get the semaglutide or the GLP-1?
I think that if you're over 400 pounds, you already have one foot in the grave. So yeah, that's a pretty good amount. Honestly, you want me to tell you the truth? 10 pounds.
Okay.
10 pounds and up. 10 pounds and up. We have been doing this clinically now. What we do is we don't titrate the dose up all the way. We keep it on a low dose. And instead of losing 20 pounds a week, you might only lose 1 or 2. But you do weight loss slowly instead of rapidly. What happens when somebody loses 100 pounds or 80 pounds and then stops its medication, they're going to go right back to what they were doing, right? You didn't teach them anything. Now, with the people that we have found the most success is by, oh, you have that 10, 15 pounds that are stubborn, right? This is the thing too, Marcia. Those are the people that are doing everything right, and the weight still doesn't come off, right?
Yeah.
And this is where you keep it on low dose. You get all of the other health benefits. Remember, let's be. Instead of going up and just thinking it's weight loss, imagine if I were to give you tirzepatide and keep you at 20 units for 12 weeks instead of after 4 weeks going to 40 units and then going to 75 units, right? That's the titration up. If I just kept you at 20 units for the same 12 weeks, you might not lose 50 pounds. You might only lose 20. But what you're not bringing into the full scope is looking at how it's retraining your brain on how to view food. We're looking at how it reduces cardiovascular disease. You're not looking at how it helps with your over drinking and overeating. You're not looking at it from the reduction in Alzheimer's. We're not looking at it from the reduction of dementia. We're not looking at any of these things, right? We're just looking at weight loss, where we have to start really looking at how effective this medication is on just more than weight loss.
Now, another slant to this, though, I would imagine if your blood sugars are under control, you're going to feel better.
You know what? That's a very, very interesting point, and I'm glad you asked that. Yes, you will, but not at first. If you take a diabetic that's hemoglobin A1C, let's just say it's at 7, which is high. We want the ideal measure of hemoglobin A1C. Let's tell the listeners the difference really quick. Hemoglobin A1C is a longitudinal measure. Now, if I prick your finger right now, Marcia, right now I get your glucose, right? Right? I get your immediate glucose. If you were to finger prick every day for 90 days and get that as an aggregate, that is your hemoglobin A1C, right? It's your hemoglobin A1C. If you have a diabetic with a hemoglobin A1C of 7.0 and you magically find a way to get it down to 6, they're not going to like it. Their body is not going to like it. It's going to take time. But after there's that re-equilibration, or what I like to use the analogy of resetting the thermostat, right? You get home on a hot day, it doesn't cool off instantly. But if you wait 30 minutes, it's going to be pretty damn comfortable, right? So that's the way those things work. Eventually, yeah, when you get your blood sugar in control, you will feel X amount. It's night and day. It's just you have to be a little patient for that one.
Oh, okay. That I mean, it does make sense, So I'm glad I brought that point up, because I was wondering about that when we were talking in the last segment and forgot to ask you about that. So then again, I'll play devil's advocate. Can somebody lower their blood sugar too low on these drugs?
You can get bouts of hypoglycemia if you don't eat at all. However, with Telewellness MD and people that we personally and clinically treat, we make sure that we go over. One of the biggest things is in the lifestyle modification is we control your first meal. You do not get to think about this.
Mm-hmm.
And what we do is we make sure, remember, we're slowing gastric emptying. We're going to make sure you put the best food in your stomach.
Mm-hmm.
The best meal, we'll say, not food, let's just say meal composition.
Mm-hmm.
And that's where we could kind of get away from the hypoglycemia bouts. If you don't eat for 2 days and you go running around, you can get bouts of hypoglycemia. But we take that because anybody that takes GLP-1s through our management, we go through lifestyle modifications. It's a contract. It's a contract if you want GLP-1s through us. If you want it, we'll give it to you. Not a problem. You want that 10 pounds loss? You want that 15 pounds loss? Not a problem. But you're going to do as we say when it comes to the lifestyle modifications. And if you don't, we don't get you the next script.
Mm-hmm.
And I'll tell you one thing. If you're, there is this one woman I work with. She's in her early 40s. And her confidence looking in the mirror, right? She's down 12 pounds in like 8 weeks. And she's like, I will do whatever it takes to not go back to the way I looked.
Mm-hmm.
That's the other thing that we do not take into consideration too,
Mm-hmm.
right? How we feel when we look in the mirror, and you know this, is when you look better, you feel better. When you feel better, you look better. And I think that's a very powerful thing that sometimes get overlooked is sometimes we overeat because we're sad. We overeat because we've given up. We overeat because we don't like the way we look. We overeat because of this. And it's changing our mindset. It's an amazing, amazing transformation where by doing this and having a contract with our patients that they're willing to do even more now that they've got where they want to go.
Mm-hmm.
And to me, I don't know from a clinical standpoint, it brings me tears of joy to see that because now they know what it takes. And
absolutely.
it's really special. I think it's really special if you could get people to really buy into it and do the right things. It's an agent. It's a tool in a toolbox that it changes. It's going to change a lot of people. It's going to change a lot of people, and I'm very, very excited and happy to be part of that change.
Absolutely. All right. In full disclosure, I am not on any of the peptide therapies currently, although it is definitely tempting me to want to try them. I am not on the peptide therapies that we have talked about. I'm 5'9". I'm about 135 pounds. I don't really have, quote unquote, weight to lose, but I think we all just always want to feel better in our clothes. I mean, it's just kind of human nature to want to feel good and look good. But in full disclosure, I have not tried any of these therapies, and I'm sure people that know me are wondering whether or not, based on this conversation, whether or not I have. So I thought I would throw that out there. I am going to put I do have an affiliation with TeleWellness MD. I am an affiliate of them, and my affiliate link, if you want to get started with these peptide therapies. Plus, they also have additional products such as B12 shots, which I'm a huge fan of. Again, the more we talk, Stephen, the more I'm thinking we are going to have so many topics that we need to talk about because I think both of us are very headstrong and very, very determined to try and help people. So I cannot wait to have you back on another show where we can pick up. I think we've already established we want to do one on low-dose naltrexone, which I'm another fan of. And I also, on the break, we were talking about erectile dysfunction drugs and the benefits of those, which I had no idea about. So I definitely want to have you back on for that as well. Anything you want to add before we close out?
Thank you so much for having me. And please include my email address if you want. I'm happy to help field questions and help you out. And to the listeners, it's when the perfect time to change is?
When?
Right
now. I answered it before you said it because I knew what the answer. I know. Again, I go back to I'm a big fan of Tony Robbins, and I read this book every year. Last week of the year, Awaken the Giant Within, and it's the essence of his book is the power of decision and how in the instant, if you can make a decision to change your life, and you do, that is where you'll have the largest growth in your life, and I totally subscribe to that. So Thank you again, Stephen, for being on the program. And perhaps what we could do is schedule a Zoom Live or a Facebook Live where we could actually have people ask us questions live because, again, you and I both are on the same page. And if we could change people's lives one podcast or Facebook posting at a time, I'm all in. Are you?
Sign me up.
Awesome. All right, Stephen, thanks again. You're listening to Elevating with Marcia. Thanks for tuning in. If you want any more information, DM me through Facebook. You can also direct text message me at 413-374-2100. You can find me all over the internet. Not hard to find me. And then also the link to Telewellness MD is going to be in this post. Thanks for tuning in. And if you want any more information, check us out. Have a good one and make it a great week.